Welcome to the Compliance Advantage podcast. This is where healthcare executives transform compliance from a burden into a strategic asset that drives both growth and peace of mind. I'm your host, Ross Ronan, founder of Ronan Healthcare Compliance and a healthcare compliance strategist with nearly 30 years of industry experience. I'll help you stay ahead of evolving regulations while building the sustainable, compliant organization that lets you focus on high-level strategy and exceptional patient outcomes. Remember, compliance pays dividends. Invest today. Welcome to the Compliance Advantage. Today we have a very special guest, Baxter Lee, who is the president of Clearwater Security and Compliance. Thanks for joining us, Baxter. Appreciate it.
Yeah, thanks for having me, Ross. Look forward to the conversation.
Tell us a little bit about your background. I know you've been around the block in a lot of different areas and a lot of different things, which is amazing because you don't see that very often. But I think investment banking, private equity issues, CFO, and now you're president of Clearwater. Kind of tell us through that journey of kind of where you've came from and where you're at today.
Yeah, I guess I've made it to the point in my career, but I can be referred to as having been around the block. So
Yes.
accomplishment in and of itself. Yeah, no, I started my career. I was a business major in college and started in finance, and went to work for Merrill Lynch Capital in their healthcare finance group, and so that's how got brought into the healthcare industry. Early days was underwriting, transactions and debt facilities for hospitals, nursing homes, home health businesses. Really got to learn the healthcare ecosystem, reimbursement challenges, legislation that impacted, healthcare providers at the time. We worked with organizations that were also going through bankruptcy and turnarounds. So understood or learned some of the challenges of operating in healthcare and what led to, some of those situations. So that was a good 3.5, 4 year experience. And then, went and spent 2 years with a lower middle market private equity fund, more of a generalist investor. But it did one healthcare transaction focused on, the Medicaid dental space.
Okay.
And so again, very regulatory compliance driven requirements when you're operating with children and in the Medicaid market and in the dental space. And so after that period of time, I really kind of realized I wanted to be more on the operator side of the table and not on the transactional side. And I got to know these businesses really well. I got to know their executives and leadership teams well through the transactions, but recognized like I wanted to see something through a little more, and really found myself being intrigued with what made operators tick, what made them successful, where they, how they overcame challenges. And so started to think about a career shift, and was fortunately I was recruited to move to Nashville about that time to work for MDON, which was the predecessor to Change Healthcare.
Mhm.
So it was a large publicly traded platform at the time, with private equity support as well. And was able to do corporate development, M&A strategy, but really more from a internal corporate development strategy perspective, and was able to really, extend my reach into the healthcare IT side of healthcare through that platform, and learn a lot more, but do it from more of an operating perspective, and then transition to an internal divisional CFO role. And then in 2015, spun out and went to an early stage startup, called Atrada Health. It was a mobile dictation platform for physicians that were struggling with productivity challenges of the early adoption of EMRs. And we grew that business and sold it to NextGen Healthcare before I joined Clearwater, as CFO. And then after 7.5 years as the CFO of Clearwater, we went through a transaction with Sunstone Capital Partners, and that gave me the opportunity to step up as president of the company. I've been with the company since we had 30 employees. We've grown it to over 270. So I've really been involved in a lot of the operational aspects of our growth over the last several years, and excited to be, leading the company as president and through this transaction or phase with the Sunstone Growth Partners.
I mean, that's a huge growth, and I'm sure as you've kind of went from CFO leader to president, right? Now you went from 30 to 270 employees. You got a lot of leadership responsibilities there. Is there any philosophy or any kind of mentor or book out there that you've put on your shelf? I always like to have this conversation because we talk about with a lot of CEOs and board members and people who just like, but, and I find it fascinating too. I've got several books that I'm just like, I really like these or mentors that I have. Do you have anything out there that you want to mention or plug?
Yeah, I read a lot of, books and management, kind of, journals and other things. I'm not a big fiction reader, actually. I read a lot of more business, and boring sort of books around how to grow businesses and build teams. Yeah, I'd say, collecting over the course of my career, just, what I've seen work with other leaders. Again, what sort of inspired me to get into operations was, seeing what made them successful. Really take a, transparent approach to leadership. I think hopefully everybody on my team kind of knows what I'm thinking, what the, goals and objectives are in front of us. Also try to lead with empathy. I want to make sure I really truly understand what everybody's going through and what may be causing, constraints or challenges, and not just assume that it's a skill set gap or things that they're outside their control maybe. And then accountability as well, right? Setting those clear expectations and then holding people accountable to that. So transparency, empathy, accountability, and I think finally mutual respect, and just making sure that regardless of what we're going through, everybody treats each other respectfully. And I think if we do those things together, we can overcome any challenges and come out on the other side, stronger. And that's sort of the philosophy I've sort of built over the course of my career.
It really is a great philosophy, and I have this conversation with a lot of kind of business owners or kind of heads of companies. I think like with Clearwater, with like what we do, being in like the cybersecurity and compliance space,
Yeah,
it's a hard place to be when you're an employee and you're working on stuff that is really detrimental or can be detrimental to an organization.
yeah,
And, with cybersecurity, all it takes is one breach or one attempted breach that sends the whole company into a tailspin that you've got a responsibility to protect, right? It's the same thing with kind of the compliance side on fraud, waste, and abuse and False Claims Act, et cetera. Having that kind of mentality where the people can spin out of control pretty quickly because there's such high pressure is really important.
absolutely. Yeah, I think, fundamentally, we're all going to make mistakes, right? Whether it's, your operating compliance or security program, it's never going to be perfect, or just as
Mhm.
individuals in our roles throughout your career, you're going to make mistakes. So it's how you react to those mistakes and recover, learn from them and recover from them and improve over time. I think can be said for, building your career successfully as well as running a successful compliance or security program.
Completely. All right, so let's get into compliance a little bit and and
Sure.
cybersecurity. So you kind of sat on both sides, which is amazing that you're able to look at kind of financing, deal structure when it comes to M&A, and then getting into operations and just all kinds of different operations, whether it's kind of healthcare provider basis versus just tech basis or security basis information. Where do you see, because you've probably done this on both sides, or at least have that question, where do you see these healthcare executive boards just kind of maybe missing it a little bit, or maybe that's actually maybe their biggest misconception about what they're trying to get into first before they kind of missed what they're really looking for?
Yeah, I mean, it's an evolution for sure, and I think there's folks across the spectrum of those that take it more seriously than others, and up and down sort of the investment world. I'd say where I see some of the shortfalls coming is taking a diligence report and then it becomes, a static document that sits on the shelf somewhere and it's, not actioned into, a part of the, the operating plan of the company. Right. And it's like, well, we got advice from our lawyers. We check, we got our diligence report check, but then it doesn't become an operational part of the business. And, we see time and again where we come in, and we'll actually review, prior diligence reports or diligence that we did on an organization, a year or two later. And a lot of those things just haven't been done. Right. And I think that's the ultimate, challenge is making sure it's first, it's prioritized effectively and they recognize the importance of, you know, the reason you do the diligence is to make sure you understand where you need to make adjustments and not just check a box. And I think that's, we see that unfortunately across healthcare in general. It's there's a lot of reporting and static reporting and point in time assessments. And what you really need to do to operate in today's environment is really have a continuous, ongoing, proactive program that manages to your goals and objectives and aligns with regulations and those types of things. And I think we see various organizations do better with that than others.
I see it across the board too. This common misconception is I just did it, I checked the box, and therefore I'm
Yeah.
protected. And I agree with you. We call that a bookshelf compliance program. You probably call it the same thing on the security side of it, where you're just like, here's all my policies, here's what we've done, we've done a risk assessment, we did an SRA, all these things,
Yeah.
and now we're
Yeah.
gonna put it on the shelf and go, check, we've done it, we're covered. And you're like, "Mm, not quite, not quite." You actually, it's
You have
got to
to
do something.
operationalize it. Yeah.
Right, it's gotta live, it's gotta breathe, it has to morph, it has to enhance, it has to do all these things, and we often talk about being a proactive program versus a reactive program, right? And I'm sure you see this in Clearwater all the time. It's like you've gotta be testing, you have to be out there kinda making sure that your fail safes are working as opposed to just saying, "Yeah, we got a bunch of policies in the back shelf, and when something happens, we'll fix it."
Yeah, I mean, I think that's where we see the biggest opportunity in healthcare is that resiliency aspect of, you have policies, you've got procedures, you've got things in place. Have you tested it? Have you determined if your controls are working effectively? Do your people know what they need to be doing and what they should and shouldn't be doing? Do you know how you're going to respond in an incident, right? And testing those procedures. So, I think there's a lot of room for maturity there. I think the industry's come a long way in the last several years. If you look more from a cybersecurity perspective around implementing fundamental controls for things like multi-factor authentication and endpoint detection and things of that nature that didn't exist 2, 3, 4 years ago as frequently or as robustly as they do today. Those controls are in place, and I think that's a big, improvement over the last few years. But the threat actors are evolving as well, and if you're not testing your controls, making sure they're actually achieving the intended objective, and then your own ability to respond and recover, then you still have a gap in the program.
Yeah, I mean, with technology improving, got AI out there. I mean, both of our worlds are constantly kind of morphing because everybody's trying to attack, everybody's trying to get in, everybody's trying to figure out how to defraud the system in some way, shape, or form. It's pretty amazing at some point in time. Sometimes sit back and I go, "Can we keep up?" Like it's just amazing how much is out there.
Yeah, not to mention the changing regulatory landscape, the
Oh,
different
yeah.
state requirements, right? I mean, it's a lot to keep up with. So you're not only dealing with changing threat actors and more aggressive, offensive capabilities, but also, the defensive regulatory aspects that you need to keep up with. And so, if you don't resource this appropriately, you can find yourself falling behind pretty quickly. And what we see in the private equity market, is these organizations are built to grow and scale,
Right.
but their compliance and security programs don't always keep pace with that growth. And so you're actually introducing more risk to the organization, or the risk profile is expanding as you're growing because your program's not set up proactively to grow, at the same pace.
This episode of the Compliance Advantage podcast is brought to you by Ronan Healthcare Compliance. At Ronan Healthcare Compliance, we believe in transforming healthcare compliance from a checkbox attitude to a strategic advantage. With decades of expertise, our team of consultants provides innovative solutions tailored to your organization's unique needs. We don't just help you meet your standards. We elevate your business, ensuring ethical practices are at the heart of what you do. Whether you're navigating complex regulations or seeking to enhance your compliance strategy, Ronan Healthcare Compliance is your partner in achieving excellence in healthcare compliance. Ronan Healthcare Compliance, redefining compliance, empowering leadership. Visit us at ronanhc.com to learn more. Now, back to the show.
Growth of your compliance and your security programs as these companies are growing. The whole point, and I see this a lot with private equity, we work with the majority of private equity groups as well, or healthcare investors, is that they want to grow this business, not necessarily for profits or money. It's to expand network capabilities, extend provider base, extend being able to provide healthcare to a lot of different people in a lot of different cost-effective manners. And a lot of people don't feel that way, but it's true, and that's how at least the ones that we deal with or
Yeah.
on that standpoint. So they're always talking about growth. Now, this is the compliance advantage. But one of the things we talk about under the compliance advantage is how do you change your privacy security, your healthcare compliance programs from this, like you said, like a cost center that just kind of sits over here and is not able to grow and scale to something that is more of a advantage for them. They use it for kind of sales, they use it for partnerships, they use it for patient satisfaction. How do you see that, or how do you talk to different healthcare providers just to say this is how it creates enterprise value?
Yeah, I think you and I probably talked about it very similarly, right? I mean, compliance and security can be a liability to your business, and if done correctly, it can be an advantage. And so being proactive pays dividends over the long term, and avoiding negative events or mitigating the impact of those potential events, and also positioning your business to grow and scale. So I think we think that starting early, right, and particularly at using those diligence reports right at the transaction, and building it into all the plans that you have in place for, M&A and growth and operations and everything else, compliance and security should be right there with it. So that you're implementing that foundation, and you're in its position to grow with your business. You have a playbook for M&A. You have a playbook for growth. You're training your employees effectively along the way. Everyone understands what achieving certain milestones means for the business. If you take, HIPAA, for instance, a lot of the rules and regulations around HIPAA have, you know, pretty, kind of, I would call them obscure, applications in terms of their, the reasonable and appropriate language. Like, what is reasonable and appropriate for your business? And that is up for interpretation. So if you're buying a, physician founder run business, what was reasonable and appropriate for them pre-transaction in the eyes of the OCR, the federal government, is a lot different than the day after you close, and now you have institutional capital behind it, and you should know better, right? And so now the bar just went up, and you didn't do anything other than close the transaction. So if you're not improving day one, you're already behind. And then with the growth and scale of the business through M&A or other, organic initiatives, de novo, office expansion or things like that, now you're falling behind, right? And so that's where I think that organizations really struggle, is that early building that foundation early in a way that it actually allows you to achieve those goals and objectives. And I can tell you, we've worked with portfolio companies where they have had to go to the board and say, we have to stop doing M&A because we have to catch up. And that is probably a terrible position to be in year 2 or 3 of an investment, when you're telling the investors to stop, investing and stop growing because your IT security compliance can't keep up with the pace of growth. And I think, to your point on, creating, enterprise value, right? That's clearly eroding value if you can't execute your growth strategy, as a result of not having that foundation in place.
Or even worse, doing it without, regards to the red flags that are out
Oh,
there. And now you find yourself really in a bind
absolutely.
where, yeah, one of my previous lifetimes, we had a number of different corporate integrity agreements that came from acquisitions that were done 10, 7, 8, 10 years before that, that truly, didn't have good diligence on it, or didn't have anything that we were supposed to responsible for. We're doing a great job today, but historically it was just a problem. And I feel like that's kind of where it slips through the cracks a little bit to say, hey guys, you have this, but now you have to make sure that your compliance and your service, your security systems are growing with your entities. And by the way, integration is huge, right? You're going to integrate all of these different things. I mean, you guys more so than say our standpoint, but all these IT integrations can really change your EMR. I mean,
Yeah.
how many times have you come across that where someone changes their EMR is sitting back here on the server and no
Yeah.
one's protected it, right?
Yeah. Yeah. No, and I will, on the positive side, I think we've seen that come a long way. If you go back to kind of pre-COVID, the M&A strategy, the roll-up strategy in the PPM space was really a lot. What we heard a lot and saw a lot was, we don't want to disrupt the provider workflow. We're going to take the IT infrastructure as it comes, And then, 2, 3 years in, they would hire some poor CIO to have to, bring it all together. And that was a nightmare. I do think we see more standardization on the front end, and private equity firms recognizing the need to pick a platform, a tech stack, and tell the doctors up front, hey, it's going to be a short pain, but we're going to move you here and we're going to get scalability and efficiency, and it's going to be better for the enterprise long term. And that comes with compliance and security advantages as well, because you're dealing with a less fragmented infrastructure that you have to manage. So yeah, I do think there's been an evolution over the last 5, 6 years towards a more from an IT perspective that makes the business more scalable, more secure. One set of policies and procedures that then can now be applied across the infrastructure. And then having that M&A playbook of, okay, when we acquire something, we're going to move things over quickly onto this new tech stack and not, maintain these legacy applications and servers and things that can create a lot of liability for the business. So we've seen that evolve a lot, but I do think, it varies again across the spectrum. Certainly the more upstream, bigger firms have those playbooks built. And I think the middle market, lower middle market sort of working through that still today.
Yeah, I completely agree. And I also feel like there's some middle market investment firms that have a little bit more maturity when it comes to doing a healthcare deal. Either they've been burned in the past or they've
Yeah.
kind of done something they have to go unravel, that they get it. And then there's just some that you get tapped on the shoulder at the last part of the diligence cycle to say, "Hey, we're closing in 30 days. I need a compliance, I need a security assessment. Like, I need these things done real quick. Can you do it real fast?" And the answer is, "Yeah, but you're gonna have a laundry list of things you gotta do thereafter." You know?
Yeah. And that you see those firms being more reactive than
Yes.
proactive. And it's not just private equity.
Oh,
We've worked with health systems that do
mhm,
M&A, right? And yeah, one large health system came to us and their IT department was overwhelmed. Every time they would do an acquisition, they'd have to put down everything they were doing and then go do diligence. And they're like, we don't know how to do due diligence.
right.
We're not set up for that. And all we have this, we're staffed to do this operational IT work. And they wanted us to come in and help them build a playbook for, doing diligence and
Mhm,
integrations of their acquisitions. And so, I think, it's across the spectrum, but I think if you're in the business of M&A, and that's part of your growth strategy, you need to build a playbook that is resourced appropriately. So you can, tackle those challenges through the transaction, understand what you're acquiring,
mhm,
what the legacy liabilities might be as a result of what you're acquiring, and have a playbook for how you're going to integrate them and what the timeline is. You've seen it in mergers before. If you go back to the Starwood Marriott merger, right? It was publicly announced that they were going to consolidate platforms. So guess what happened? They stopped investing in one of the two platforms, and the attackers realized that, and they got, access to the Starwood databases during that integration process. Yeah, that can happen in M&A, and the press releases, the things that people put out, when they want to tell their growth story to the market, only also, that also advertises to the attackers that, hey, there's this disruption happening here, and you're now a target as a result.
that's really good insight too, and I don't know that, I don't know that I've had a guest really put it out in that manner, because I feel like that is a really important message to get out there. Is, don't just say you're doing it, you gotta do it,
Yeah.
because if you don't have your protections in place, you've just told everybody you're going through a transaction or you're going through an integration. And now you just really have not and I think the government's looking too on our side of it with fraud, waste, and abuse, and false claims act issues. They go, "Okay, you are in this process of integration, you need to fix it." You've talked a little bit about, and I love this idea where, cybersecurity and compliance and privacy and technology and everybody working together to make sure that um, everybody is protected. I've always talked about this too, because we don't do what you do. I mean, we don't do security work. We don't do HIPAA security standpoints. We don't do SRAs and all the other kind of things associated with it, because part of my thinking is you guys are the experts in this industry. I'm not. Could we hire a bunch of people and probably do it? Yeah. As well as you guys? No. And I would like our clients to have the best resources known to man. And those are people that are experts in their industry, right? With like you guys. And so when you think about, and I think you've talked about this a little bit better than I have in the past, cybersecurity, privacy and security all coming together as a kind of it's not a single functionality. It's not your job. It's not my job. It's all of our jobs. How do you see that as an integrated program? And what does that look like to make it actually work?
Yeah, I think the integration is critically important. I mean, privacy, compliance, and security all intersect. If you had a Venn diagram, there's definitely elements that all kind of interrelate with each other, and certainly through your governance and policies and your risk management, structure that you're operating as through your organization should have constituents from all three, built into your operating plan. And I think that's probably going back to one of your earlier questions. Another challenge we see, under investment in one of the three or two of the three. So they may have a compliance officer, but they don't have a security officer or vice versa. Yeah, I can't tell you how many times that, I've talked to, investors where they're like, well, we have a really good management team that's been in healthcare a long time. So they know what they need to do. I'm like, well, how do you know that they're doing the things that they need to be done? They may or may not be, right? And yeah, unfortunately, the ones that are the most proactive that we work with are or leadership teams that have been through a situation in the past. They've been through a OIG investigation or a HIPAA investigation or the cybersecurity breach or something, and they've learned from that experience and they're bringing that to the table. So, that doesn't, not everyone's been through those situations. So, if you haven't been tested and you haven't, you may think good is good enough and you really need to be doing more and you may have gaps. I think there's knowing your blind spots, making sure your teams, you've got, appropriate people tapped for privacy, compliance, and security, and that they're working in a coordinated way to make sure you're mapping to all the rules and regulations and best practices for your industry and your business are critically important. And, we look at it from a programmatic perspective, starting with governance
Mhm.
through risk management and then technical, from a security perspective, technical testing of your environment and your controls. And then resiliency, as I mentioned earlier, how well is all that in place and to be tested that, you think we're doing these things, but can they be exploited? How well can you recover? Have you done a tabletop exercise with your leadership team? Do they even know who they would call if they had a cyber attack, right? Or a breach? And so, the testing and and then, it's a continuous process. And I think that's the challenge. It's not, I did a risk assessment or I wrote a policy or I did a, pen test. It's, you learn from those things, you put improvements in place and then you retest and you do that over and over and over again continuously. And you're never complete. It's never over, right? The threat actors are changing, the regulations are changing. So you're never fully, compliant or fully secure. And if you don't have that program in place to be able to do that continuous process, that's where I think you end up with gaps.
Yeah, I mean, it's funny because I tell a lot of people that I mentor, if you think you're gonna wait until your work is done, your work will never be done. Like, I
Right.
can guarantee you, you'll have peaks and valleys, but your work will never be done, and that's a good sign of a compliance and a security program,
Yeah.
from that perspective for sure, and I love it when I don't love it, it always gives me pause when I've got a leader who says, "You know what? I've got Joe who can do security and privacy and compliance and copy and all these things. Well, they've got all these experience and it's really about a money saving issue, right?
Yeah.
As opposed to investing in your company and in your programs. And I'm not opposed to like some person being responsible for all those as long as they're using the right people to help them, right?
Yep.
Whether it's you guys or somebody else to come in and
Or
go, I need support. I need help. I need something here, right? And it all becomes different facets, whether you include different departments or you have one person with different kind of expertise underneath them. That still is a department of
Yeah.
multiple different expertises out there. So
Yeah, and I think, we see that a lot, right? Again, if there's a founder-run business, the main doctor, I've seen situations where, the wife was a practicing attorney, and so now she's operating as the compliance officer, and, she's learning compliance as they go,
and general counsel
or
and employment counsel and
exactly. Yeah, and then or yeah, you have other executives that, okay, well, they're just gonna we're gonna appoint them the compliance officer, the security officer, right? And they don't really have the experience to do that. And I think that, is to your point, is a bit of a money saving exercise, but it makes people feel good that you've got somebody wearing that hat, but they don't have the background and experience or the bandwidth to really do it effectively. And people ask us all the time, like, well, when should I hire a security officer? When should I hire a compliance officer? It's like, how important is it to your business, right? I mean, it's kind of, there's no perfect answer, but if you're waiting until you get to a certain point, you're clearly, missing that opportunity to build the foundation and build it up. And frankly, I think it's cheaper and more scalable when you do it earlier in the process than waiting a year or two in, and then you've got to reverse engineer, IT and policies and different things to meet your current operating environment and close those gaps than if you would have invested earlier, right, and built it up to scale, even if it was on a fractional basis, having someone to own that to come in, that then you could hire somebody into that role that can hit the ground running as opposed to coming in and cleaning up, gaps and lack of investment from the prior periods.
yeah, we that's kind of the same and similar advice we give to other kind of leaders and CEOs is don't wait until something happens because it will
Yeah,
happen. I
yeah,
promise you it will happen. Like I have never been around and I've been around for 20 plus years doing this. I've never seen it not happen. It
yeah,
will. Right? I mean, if it did, we wouldn't exist. If it did not happen, we wouldn't exist. But from the standpoint of, I mean, how much kind of in your experience, how much does it cost to unring a breach bell
oh,
versus what it would take to kind of invest up front before something even happens? I mean, one's a few $100,000 maybe, and the other one's a couple million. Like it's just
yeah.
crazy.
Yeah, if you're talking about a breach or a cyber incident, it's 10 to orders of magnitude that more expensive to clean it up after the fact. I mean, the you don't want to be testing your incident response plans live, for the first time during an incident, right? And so I think that's a big challenge. And, we have clients that'll pay us 10x on an ongoing basis after a breach to do the things we've been, say that you could do than they would have, spent prior. And that's not even to deal with the remediation efforts. That's actually operationally, getting it to par for where they should have been, before the breach. So I think that, we see that if you look at Change Healthcare,
Yeah.
they spent
Huge,
billions
huge.
rebuilding the platforms and the infrastructure. And I mean, so clearly an ounce of prevention, done the right way could have been significant in terms of saving that organization a lot of public, reputational harm as well as financial, harm. So it is significant if you haven't invested appropriately on the front end, what you end up spending, after an event happens.
You hit a really, really good point, and I really want to make sure we've covered this a little bit. One, the change event, obviously, the downward effect that it had for all the providers that
Yep.
use change, everybody else. I mean, I had several clients who were kind of wrapped up in that. I'm sure you did as well. But one thing that you said, which I think is really important, is on a cybersecurity event, anything HIPAA related, the number one thing, and you don't see, huge, $999 million, billion-dollar settlement, which we've seen that in the False Claims Act arena. But the reputational harm that you see with any kind of breach that's out there with Change or anybody else, people just one of our kind of pillars of compliance as an advantage is patient trust equity. Patients got to trust exactly what you're doing as a provider, and if they don't think that my PHI, my PII, my financial, my my healthcare security is safe with you, I
Yeah.
am not going to go to you anymore.
Yeah, the industry's shifting too. I mean, look at there's everything is about, giving consumers more choice in healthcare,
Yeah.
right? There's more retail options, more technology driven options versus so I think, yeah, you're absolutely right. The reputational harm now is, plays into that. And if they can't trust you, not just with with their outcomes and what you're trying to achieve from a health perspective, but with your data, I think, you know, I think that definitely has an impact on, where they're going to take their care, if they have that choice. Obviously, if you're in a critical emergency situation, you need access to the best hospital in the region, you're going to go to the hospital regardless. But I think we're trying to engineer a system as we try to lower costs, drive, consumer behaviors and value-based care. Yeah, I think there's a lot more opportunity where, patients do have choice and reputational harm can be significant in this industry now.
Yeah, lowering cost of healthcare doesn't come in the form of stopping the things that can have controls in your organization so you don't have big issues,
Yeah.
right?
Yeah,
It's
that's not the area to save.
not quite the same as saving money, right? You guys just got private equity. You said Sunstone, I think, backed you guys, and then you're now president from the CFO position. What does it look like for Clearwater now? How are you building out your kind of your compliance infrastructures and leadership, and what are you doing there?
Yeah. Look, we see, a lot of opportunity in the space across the ecosystem of healthcare, and we really do look at it as an ecosystem. So you have, health plans and large hospitals. You've got your ambulatory providers, and then all the vendors, digital health companies, and others that sell into healthcare. And so, I would say on the whole, right, healthcare's been slow to adopt technology and they've been slow to invest in security around the technology that we have adopted. So there's been a big push for the last 20 years for medical records, electronic medical records and digitization. And now all the sharing of that data, that was engineered through the High Tech Act. And, we're getting the results that we wanted, but that's creating a lot of fragmentation, which creates a lot of vulnerabilities. And the more we share data, the more access points there are between constituents. And we're just creating data at a greater volume as well. That just creates more vulnerabilities for the industry and for the ecosystem as a whole. And so, we're working across the ecosystem, working with large health systems on their operational, security, HIPAA compliance, programs. And then we work with, the ambulatory providers, particularly the institutional backed roll ups and things of that nature about, and also value based care platforms that are trying to grow very aggressively and may not have the internal resources day one or throughout to put the infrastructure in place. So we kind of come in and build those programs out, operationalize them, run them for them. And then at some point, they may try to bring it back in house, or some point they realize that, it's still just more cost effective and better for them if we keep running it and they focus on, their core mission of executing their strategy and not have to worry about managing all the challenges of cybersecurity and compliance with employee turnover and changing regulations and all the challenges that go along with it. So we see a lot of partners that, we've grown significantly with, and they just keep wanting us to do it for them. So big opportunity across healthcare. And then the last piece is vendors. There's a huge market in the vendor space, and more of them are bringing on data or interfacing with, technology platforms of their counterparties. So they want to sell to a hospital or they want to sell to a health plan. They need access to data and technology. Well, vendor risk for those health plans or providers is the fastest growing risk. And so they're putting more pressure on the vendors to demonstrate security and compliance effectively in order to get that contract in place. The security reviews are more intense. The questions are, longer than they've ever been. And so, it's important for the vendors to invest in their security, talking about a competitive advantage, right? Like if you can go into those conversations proactively and say, we take security and compliance seriously. Here's our playbook. Here's everything we're doing. You can trust us as a partner. you can get through that security review faster and win those contracts. You can grow and achieve your revenue goals faster than if you're reacting to those and then trying to scramble to put, those answers in place. So we think there's a big opportunity to be proactive in the vendor landscape to grow that market and for vendors in that space to grow more effectively. So we're investing across all three end markets. We see a lot of opportunity, in different, kind of same services, but applied differently in those different markets.
Well, I love what you're doing. I think your growth strategy is right on the money, right? And I also think that, um, for me, the reason that we started this business is we want to help. We want to
Yeah.
kind of bring expertise across multi lines to people who might not be able to have that or be able to hire for that. And I think that's really kind of a struggle that they've seen. A lot of people have seen in healthcare across the board. So, I commend what you guys are doing, and I feel like your growth strategy is pretty amazing in that whole structure. So.
Yeah, appreciate that. Yeah, we're a very mission driven organization. Our employees care very much about, the mission of protecting the healthcare ecosystem. Our mission statement is we want to help our clients be more secure, compliant, resilient so they can achieve their missions, right? And this is not, it's not rocket science, but it's also not easy, right? And I think part of it is there's this changing landscape we've talked about, and there's not enough CISOs and compliance officers to go around at every organization. So there's a shortage of talent as well. And so, that we kind of play in the space of, you're doing something today, but you kind of really need to be up here. And so what's that gap? All right. And we want to close that gap for you. And so you can achieve your goals, objectives from a business perspective, protect your patients, protect their data. And so we're just trying to help close the gap. And I think that's ultimately, what we're all about here. And our employees really wake up every day, taking it very seriously. And I think it's an important mission to be behind.
That is well said. Well said. Well, last question. I really appreciate your time today. Always ask this because we believe in healthcare. You should always take care of yourself, health as well. What do you do to take care of yourself and to keep your motivation going and your energy going and your physicality going?
Yeah. I'm always striving to do better. I can tell you that, with three kids under, 16 and under, and work, there's not a lot of time, but it definitely, it's been an area that I'm investing a lot more, making sure I carve out more time for myself, exercise, trying to, take my boys out to play golf a little bit just to, unwind and connect with them in a different way that I haven't been able to do when they were younger. So yeah, just being intentional about creating more personal time for me and my family. But it's hard. It's hard to balance it all. But it's trying to be intentional and making sure that you're right. You can't push yourself to the limits because ultimately, you gotta reinvest in yourself a little bit and give yourself the support to be able to achieve your goals.
Yeah, I love the discussion between lifespan and health span, right? And
Yeah,
really focusing on your health span versus your lifespan. And honestly, investing in yourself. It's the same concept. We've been talking about it for the last, 45 minutes. Being proactive versus reactive in your health life is the same conversation. Do you want to have a heart attack and then all of a sudden be reactive to that?
yeah.
Or do you want to really be proactive where you can live that kind of health span that goes a lot longer than maybe most people do. So I think that's
Yeah,
a
it's a
great.
great point and a reminder for myself to take more proactive approach as well. Yep.
Well, Baxter, thank you so much for today. Great conversation. I know that the listeners are going to love this. If anybody wants to check out, Clearwater, go ahead and check them out. Baxter is the head of that, and we really appreciate your time today. So thank you so much.
Yeah. Thanks so much, Ross. Really enjoyed the conversation.
Absolutely. Thank you for listening to today's episode of the Compliance Advantage podcast. If you enjoyed it, please rate, review, and share this episode with someone who might benefit from it. Don't forget to visit us at ronanhc.com for more resources and connect with us on social media for the latest updates. And remember, compliance pays dividends. Invest today.